Let it go. Good. Easy, let it go. Good. Let that drop for me. Good. Good morning, everybody. This is Dr. Warren here with Alex. Alex and I go way back. We're lacrosse teammates post-college.
Yeah.
What was the name of that team? It was through...
Freebird?
Yes.
Yeah.
And Brash invited me out to come play with them. Brash is a Taos University guy, so we go back in the lacrosse world. And my father, who's also a chiropractor here in Towson, is taking care of Alex right now. I'm stepping in while he's away on a well-deserved vacation. Tell me a little bit about what brought you in and really kind of your experience so far up to this point.
Yeah, a little sports injury. I ended up having what we believe is a herniated disc, and so some low back pain and sciatic going through the butt cheek and down the hamstring, and so done a lot of traction, done some adjustments. I've done some physical therapy, some McKinsey exercises. So really helped. And the fact that I can bend over and pick up my kids now is a plus. So.
Yeah, so kind of a classic presentation, and a lot of people can relate to this as it relates to just pain traveling down the leg. When you bend over, when you put your shoes on, or when you straighten your leg and lean forward, you can kind of feel and trace that discomfort or pain all the way up into the back. A lot of times sitting aggravates it quite a bit. Even the pressure of your body on the leg tends to aggravate people's sciatic nerve, especially when they're in a flare-up like this. And so he's been coming in over the last month or two. Really the first month is calming down the storm, and then after that we're focusing on function of the tissue, as in getting it to move better and getting it to become more flexible. So lumbar spine decompression therapy is what he went on after his pain kind of settled down a little bit more. The McKenzie stretches are low back stretches that we do in the office, or it's a protocol for dealing with symptoms that radiate from a lot of different areas, whether it's from the neck, the low back, even we work on people's elbows, wrists, ankles. So it's a joint-based approach for dealing with pain. And the lumbar spine press-ups are something that you can check out on our channel. They're very, very helpful for people dealing with low back issues. Even just general stiffness, it's a great protocol to follow. So we've been using that, and these problems, especially when you aggravate the area, follow a specific timeline usually. It's about 1 to 2 months is kind of where most people sit. Sometimes people can get into 3 or 4 months of really intense treatment for that type of a problem, but Henny's here kind of on the following through on the latter portion of 2 months, and I think you're really kind of progressing to a point where he's becoming active again. We're not picking up lacrosse sticks as much as we used to anymore.
Yeah.
We wouldn't make it through our Monday day, and like Alex said, he's got little ones at home, so spending time with them and feeling good doing it is kind of our focus right now, and I'm on the same boat with him. So I'll show you how I adjust him and work on his lower back, and if you're dealing with this issue, I'm happy to help you out. Cool?
Awesome.
All right, so why don't you come on up and relax, and we'll catch up a little bit while I'm working on you. You can come face down to start. We'll get moving on your mid-back first. So our Taos University men's basketball team made it pretty far this year. When Alex and I would go, I mean, when did you graduate from university?
09 and 11.
Okay, so you're a couple years prior to me, and then I'd imagine the team wasn't as solid back then as it is now.
Right, we had Gary Neal back then.
Oh, that's a different story. He played for the
Spurs for a little bit.
For a long time. Yeah. I think he had a good tenure in the NBA. A little release here for me, Alex. Let it go. Good. So you had some quality players. It was more of a challenge for the guys back then when we would go watch the games.
Yeah.
There weren't a lot of people. We didn't have a brand new stadium like they do now. So I mean, I would love if Towson became a sports town with basketball and hopefully one day football. They've got a good stadium for it. But they're making the right efforts on the basketball side of things. They had a good run of it. I was hoping for an NCAA bid for March Madness, but we'll see how it goes from here.
Football a few years ago too, went to a national championship. So
let me see it bend to the left for me. What year was that?
Oh my God, I have to go back. Right. Shout out to Anthony Davis. That was probably Pistol Pete. You remember? That whole crew.
Shout out to Pistol Pete at Ty West. Yeah. Come on your side, face me. So Pistol Pete. I don't even know. I guess that was
he's down in Texas right now.
He's a cop.
Police officer in Texas.
Yeah, he's a wonderful guy. One of the biggest, brightest smiles that ever came over and played lacrosse with us. He was a two-sport athlete, and he just liked to post up and rip shots on extra man. What a good person. Easy, let it go. Good. Lay on your back for me. Roll to your hip and face that way. Take your time doing it. So the range of motion looks really good. The reason I kind of look at as lateral bending is sometimes when people have this issue, it limits them quite a bit to one side. Usually the side where there's that lateral disc irritation. And overall, he's moving, bending really nicely into that space. His back isn't guarding as much when I move him. So he's able to get adjusted on both sides, and he moves really easily now. Let that drop for me. Good. Come on your back. Nice. Yeah, Terrence West, he played with the Ravens.
Ravens for a little bit, yeah.
They had a good team. That was fun watching them. Leon Kennard.
Yeah.
He came over. I played ball with him in high school.
What's the dude? There's a safety.
Played at Steelers.
For a while, yeah. I can't remember his name now.
Oh, he was fun to watch
Yeah.
in college. He was a beast.
I want to say Jordan or something like that.
Don't remember. Go, relax here. Let that leg drop. Nice. You're moving really well. And so from a progression standpoint, usually we start strength-based training, loading on the bar, putting some weights in your hands, moving a little bit more, kind of stair-stepping back up. So that, like, the biggest thing with this is flexibility and then capacity to handle stress, right? When you're dealing with a lumbar disc issue, right? So we start with range of motion, we start with the McKenzie stretches, and then we progress into some core loading, where you're doing some floor-based exercise, where you're supporting your back, but you're challenging your core, right? And pretty quickly for someone like you progress to body weight exercises with some lighter weights, just to feel those muscles activate, to kind of get that form going again as it relates to supporting your back and having a neutral spine when you lift, and then start a lifting program where it's spaced out and you can recover from the sessions to build up some of that strength back there. So you're naturally an athletic person, so you should progress pretty quickly through that stuff. It's really maintaining for you that flexibility. So when you go do your workouts, prep and finish with the McKenzie stretches, they'll make all the difference in the world on your recovery, and you won't feel like your back's starting to tighten up through that type of routine, right? So
Awesome.
Grateful to work with you.
Yeah,
Thanks for doing
sure.
the video. I appreciate it.
For sure.
Thanks for watching. If you need any help. So. There are a lot of muscles in the base, like a lot, a surprising amount, to create all these facial expressions that we have, and so I'm going to be doing some work on some of those muscles. Right? And then I'm also going to be working on some sensory points that will cause reflexes to help with some range. You can do this on your own very easily, and I usually tell people in the allergy time, it's like, you don't just have to take Allegra, there's other ways that we're working on some of those things, and this is one of them. Oftentimes I'll just have to get like a really kind of intense, like, just get face wash and then just work these areas out while you're in a hot shower. It's like a great time to do some self sinus massage, relaxing. Gentle lymphatic work before I get into prepping the next sinuses. My oldest is like 3 now. She's starting to request like, get great. She must be working her like that. And her awareness is actually like surprisingly good. Like she's like, Dad, the right side of my neck is feeling a little tight. And I'm like, okay. Like she just like kind of getting me to work on her, just like kind of get an attention. I'm like, oh my gosh, actually the right side of your neck is actually just a little bit tight. You're not too far off on that. I've given lots of baby massages recently, like a ton, and they love it. My 11-month-old, I like to massage her back a little bit while she's like falling asleep, and just kind of gently work on it. And like connect it. Lips together, teeth apart, flip the tongue to the roof of your mouth in there. And just relax it. There we go. Gently open your jaw. Go. Good. And relax. Gently open. This is Flex Balm. Carly, we tag it. It's good stuff. Don't get it in your eyes. Your neck and chair in just a second. But first, I'm going to work on your mid back, okay? Let me get you the tissue. Normally, I talk a lot in videos and explain what I'm doing. I'm just not doing that in this video. I'm just trying to give her a relaxing experience, so that's why I'm not speaking a lot. You're welcome, of course. You can relax on your stomach here for me. This is like the soon-to-be newlywed experience. We're just trying to relax, okay? We've got enough things going on, okay? Don't need to worry about, you know, the YouTube video in the back. We're just here, okay? Scrubs. These just, you can't move in these things. Go back to the underarm. Feel that stress. Take a deep breath in for me. That's out. And easy out. Rest your shoulders. Relax your head. Let that pressure fall. Good. Good. Easy. Nice. There you go. Nice. Good.
Yeah.
Awesome. You can sit right there for me. So you're in occupational therapy now, right?
I am.
What hospital are you working at?
University of Maryland.
Nice. What population?
I see adults in the psychiatry unit.
Do. Good for you. Turn left for me. Turn right. Stand. Good. You move relatively well. We'll work on that right there, okay? Pressure. Good. Settle your shoulders. Good job. You're gentle on this side, okay? More gentle. Just pressure. Pressure. And settle. I got you. There's the release right there, okay? Tension. Easy. Gotcha. All good?
Yeah, it feels much better.
Wonderful. I hope you have a wonderful day. I really appreciate what she does, if you can't tell already. And it's cool. We have really good patients here, fortunate. But yeah, sometimes people are hurt and they're in pain. It's hard to work with them. She's a joy to work with. Like, it is an absolute pleasure to help her out. So I'm so excited for her future. I love the connection to the office with some of our past employees, Dr. Alec and her were friends at Towson. And we got like to appreciate his smart ways and his ability to understand the topic and go into it. So we were talking about that last time, but yeah, so grateful to work with you. I hope you feel better.
Yeah,
thanks for watching.
My name is Dr. Warren here at Kalkstein Chiropractic. I'm with Eddie. Eddie's dealing with some disc pain coming from his lower back. He came in 3 days ago. Just really locked up, kink in his lower back, pain referring into his hip here. I saw Eddie. Eddie, how long ago was that when you first came in?
About a year, 2 years ago.
2 years ago. Came in for a couple sessions. Similar problem. You kind of got fixed up pretty quick, and then I hadn't seen you since then. And when did this kind of start?
It started kind of re-aggravated about 2 weeks ago.
2 weeks. What caused it?
Well, some years ago, I was lifting television. Something heavy.
That was the original injury.
Yeah, and then it kind of bothered me then, but it kind of went away for a couple of years and just recently coming back. So, something re-aggravated it, or stop on the exercise. What further time?
It's the back stretches that we gave you kind of back in the year or two ago. That helped you out a little bit, just staying mobile in general.
Yes.
Yeah, feeling right side, lower back pain, referring down. He had a positive slump test. He had some compression tests that were positive. Didn't have any neurological weakness or anything along those lines in terms of his extremities. Didn't have weakness in his foot. Didn't have weakness in any of his other muscle groups higher up. But we're looking for some of that foot drop sometimes with this type of a problem. Not the case. Neural tension for sure. In the form of the slump test. Palpatory pain on that right side. Here's, you kind of look, Carly, here's his 12th rib coming right down through here. So if you kind of draw a line like this, and a line like this, that muscle sits right through this window here, and you'll feel this right there as a trigger point on you. So that muscle guarding around that irritation in that nerve. And we're gonna get to that in just a second. So through the examination, saw him 2 days ago. I've seen him twice. This is my third time seeing him daily this week, and then we'll back off next week because he's already feeling a ton better. Not getting any of that pain in the hip. He's moving better. The biggest thing for him is waking up, and he's just feeling so locked up, can't get out of bed. It's a process to get out of bed. That stopped happening this morning. And I just said, hey, come see me a couple times in a row. I'll keep it moving well, and I'll adjust you. I'll do some soft tissue work. And his back is tolerant enough for me to be putting him on dry needling here like this, as well as traction, lumbar decompression. So he's getting his back stretched, he's getting dry needling done. I'm doing hip flex here, soft tissue work, and I'm adjusting his mid and lower back. And once his pain is under control, then we'll get at he's already really active just today. You can see he's pretty strong. So it's not like I need to build up muscle on him. If anything, just focus on the day-to-day mobility work that you're doing, and just to get on top of some of the stiffness that kind of started to creep up on you. You know what I mean?
Mm-hmm. Yeah.
Is that fair to say?
That's fair to say. Yeah. Yes, sir.
Can't say I haven't been in the same boat myself, brother.
Yeah. It's a challenge.
Can't be. You got 6, I got 3. I think you win on that battle.
Yeah. It's a battle.
It's a good battle. I'm grateful to be a
Right.
part of it. That's right. Yeah, I think we feel the same way about that.
Definitely a good battle.
That's it.
Absolutely.
So funny. It was hilarious last night. There was a circus around us. I'm sure you know exactly what I'm talking about.
Yeah.
My 2-year-old, she's my middle child.
Oh, wow.
And she'll run around, or she'll sneak up behind you. She'll like pinch the back of your calf and then run away.
Oh, okay.
I'm like, what are we doing? And she'll smile around the corner.
Pickable.
She's picking on her older sister too. It's hilarious.
Yeah, it's cute.
That's cute, man. You probably feel those a little bit more. These two on the outside, and I can kind of see the little indent in the needle itself. When I get into like a tighter tissue, it'll create a little dimple around the needle itself. Your low back feels and looked pretty good on that right side, down where we were kind of working in this area.
Yeah.
It shouldn't hurt as much in terms of some of the needles that I did, or feel as sensitive is probably a better way of putting it.
Just a little.
Yeah. And that's right where I don't want to be this. Okay, I'm gonna put some stim on this, Eddie. You've had your traction already.
Yep.
And then I'll bring you into a room after this. We'll get you loosened up, do some adjustments.
Okay. Sounds good.
And then we'll go from there, alright?
Sounds good, Doc. Yes, sir.
Frequency around 4.3, do a low frequency. This is a great tool with dry needle with stim. You have multiple channels going at the same time. It's very reliable, Japanese made. So we're going to go through channels 1 and 2. You're going to feel them both on the same side. It's going to kind of feel it together. Strong but comfortable, okay, Eddie?
Okay.
Let me know when you start to feel it. I'll be able to see it on the needles first too, which kind of helps me know when I kind of reach that level that goes beyond that contraction of the tissues.
Mm-hmm.
Is that okay? Is that too strong?
Just a little, just a tad bit.
I'll back it off. All good. How's that?
Just a little more. Yeah, that's perfect, Doc.
Good right there?
Yeah.
Alright.
That's perfect.
And you're going to feel one a little bit closer to the spine. Let me know when that one's good for you.
Okay. Yeah, that's perfect.
Okay, I'm going to back it off a little because it's going to get stronger while you lay here.
Okay.
I can change it again. Is that better? Is that good for you right now where it stands?
Yep, that's good.
Alright, you'll be here for a couple minutes, okay? Come back and pull this all for you and then we'll get you into a room, alright?
Good morning, everybody. This is Dr. Warren Kalkstein here with Robert, a veteran that comes to see us in our office. I wanted to share a little bit about the program with Community Care. Before we get started, thank you for your service in Vietnam. 1 year, 10 hours, and 5 to 8 minutes. Happy to see you in the rearview mirror when you left, I'm sure.
Yes, oh yeah.
Robert and I go way back in terms of working with each other. He periodically through the year gets referrals over from his primary care at the VA, and he goes through a program called Community Care. Our office is a part of that program where when he comes over, I have access or I'm able to give and provide care for Robert, including shockwave therapy, physical therapy, massage therapy, chiropractic care, soft tissue work, etc. So it's a really amazing program, and we've got a great relationship with the VA in that. And you can probably speak to that. I mean, Robert, in the process, he does research for a living and writes books about all kinds of events, especially field hockey. But in the process of going through and getting referrals over here, you've educated me along the way of what they look for, how to help other veterans in the community. So I'll let him speak to that. I'm going to work on him a little bit while we catch up. But if you are a past patient, or if you haven't heard of us before, and if you would like to receive services from our office through the VA, you can go through your primary care. It's a process, but it really does allow you and give you access to a great team here in Towson. Okay, I think I kind of covered the bases on that one a little bit. Anything else you'd kind of add to that relative to your experience or what you would recommend?
Well, it's a changing playing field. It used to be you simply would request through your primary care that you wanted some special services. The primary care would make a console and request that you get those special services. Unfortunately, during the years just before the pandemic, there was a lot of abuse of the system, and the system went through a complete change in the years 2019, 20, and 21. Now you still make a request through your primary care physician, but the request goes through a series of approvals. as many as 3 or 4. It used to be that you could get up to 10 to 12 appointments. Now it's pretty much 8 appointments. I would suggest that if you get approved through community care, that will provide for you some really special things that Warren does and the rest of the team do here, that, let me tell you, that extra service that you can get makes a difference. I can feel it. But when you go to schedule your appointments, use some thought behind it. Don't try to schedule and bunch everything together in 1 or 2 month period of time, because that's not going to get you the results that you want. Plus, community care is going to be watching how you use your appointments.
Yeah.
Schedule your appointments over a 6 or an 8 month period of time, because that's the time period that community care is going to give you. Use the process. Accept the protocols. They will have an impact, and if you do it in that manner, the next time you apply at community care, they're going to be more apt to approve you in maybe 1 or 2 approval process steps than 4 or 5.
So there's a couple of things that we've worked on with Robert, right? He's had injury in the war that's sustained over time in terms of an IED explosion and things of that nature that have caused some chronic lower back, discogenic, arthritic type pain that refers down his leg. So I treat him for those issues. Recently he came in with a different referral relative to a rib aggravation. So he ruled out cardiovascular issues, went to pain management. They kind of agreed with the treatment plan that we were doing, and we've been doing soft tissue work and adjustments around his mid-back where he had that irritation. So what do we help with? Musculoskeletal issues of kind of a lot of different nature, whether it's plantar fasciitis or whether it's a disc irritation or a pinched nerve in the back, right? And then I know there was a lot of information relative to the administrative side of things, but we'll help guide you through that. You don't have to remember all of that, but that's just a really good understanding that he has. Is people abuse the system in the past, so it's privy of you not to do that going forward. And we don't schedule people out that way. We don't want to use all your visits up unless it's clinically necessary, and we require to get you in here a little bit sooner. Then we'll definitely do what's best by you first. Okay, so as it relates to what we can help with, those are some of those things. How you go about the process, I hope you understand that. And some of the services and the therapies that we offer here, I hope you have a general understanding. So if you or you got somebody in your life that hasn't really followed through on something, or something has been sustained over a period of time, I see those type of problems all the time. And I think that we can really provide some breakthrough pain relief with some of the additional services that we're able to create and provide for you, and just this awesome team here. So I would love to help you out. I really appreciate the people that we get to work with. We have a great group of patients in here, but it's really special when we get to work with veterans. Our family, a lot of people in my family have served, so it's my way of kind of keeping attached, if you will, or supporting that community, and grateful to be able to do that. I've had past experiences in a setting with working with active duty at Walter Reed, where I did my preceptorship. So I have a general understanding of kind of the workups that people go through the VA system, through the military hospital system, and I just would like to continue to do so in private practice here in Towson. So, like I said, I happily invite you to come in. Grateful to get to work with you. All right. So I'm going to do some soft tissue work, some pin and stretch, some massage on his shoulders and his neck. I'm going to adjust his neck, but I wanted to share that with you. And we've already kind of worked on his mid-back, his lower back. He's just getting adjusted today, but when he gets that referral over from the VA, we'll be doing more therapies and services, and maybe we can share some of those potentially when you come in the next time, if that's okay with you.
No, that would be fine, because I'm walking proof that it works.
Yeah, we really had some fun success over the last 6 months with something that's been going on for 30 plus years. Yeah. So it's not, I would say don't give up. I'm pretty competitive on dealing with problems like this. So, and grateful to get to work with you, Robert. Okay. Genuinely, thank you, and I appreciate your service, everyone that's watching. Awesome.
So with the hippotherapy, I've been using my right shoulder quite a bit to help kids stay balanced on the horse.
And you're kind of reaching, you're not on the horse with them?
No, I'm not on the horse with them. I'm on the ground, so my arm is up at their level. And just with the height of the different horses that we have,
It's an awkward
it just,
position. for
yeah,
your
it's just a
shoulder.
weird position for my shoulder.
Yeah, that's tough.
And depending on the client, I can, switch to the left side, but that's not all the time.
So, hey everybody, it's Dr. Warren. You guys got to watch the laser treatment here. So you do something really good, which I learned about last time. Sorry if I'm talking too softly. It's called hippotherapy. I had to repeat myself a couple times last time. I was like, what kind of therapy are you doing? And she does, so it's like, let me have you explain it relative, but it's so cool that she's doing it, and I've heard a lot of this through the grapevine of working with people over the years of this like therapeutic approach using horses, and so talk a little bit more about hippotherapy.
So I'm an occupational
She's an
therapist.
occupational therapist, yeah.
And I use horses in my therapy to work on my clients' goals, so their therapeutic goals. Sometimes it's more mental emotional goals, and other times it's more of the physical and mechanical goals, just kind of depending on the client. And so I'm using the horse as a tool to kind of help me work on our goals in therapy. And horses and lots of other animals have great benefits to providing counselors therapies.
Yeah, that's awesome. So, using a horse to reinforce gait mechanics to somebody while they're walking on it, and that rhythm and that feedback, like I don't understand the intricacies of that, but I've really heard that to be very beneficial from a mental standpoint, and giving that emotional release of connecting with an animal. And then, you're working with kids too, so it's probably, you just see it unravel right in front of you. There's so much joy in that moment with kids, which is really special. But yeah, I've heard a lot about that with people that are recovering from cardiovascular events too, people that have neurodegenerative disorders, and using horses to help aid in that. Kids or people on the spectrum, or with mental impairments or mental challenges, if you will. All those, it's pretty cool how many people you can serve. I love riding horses too. You can serve me too. I'm gonna come up there and get some hippotherapy.
Let's do it.
Let's do it. Oh my God, my daughter lights up on the horse. It's so cute. And so we traveled down to Costa Rica, went to this beautiful place down there called Capos, and Capos is a little city. It's near San Manuel Antonio National Park, and went to Dominico, and just there's such beautiful areas down there. When we go to the beach, and this is probably like a how old do donkeys get? He was up there, right? This donkey was
20s.
living his best life on the beach down there, though. But my dog, what was the name of that donkey? Like Clementine or something like that. And Scarlett, lights up. It's the most beautiful thing she's ever seen, this little donkey. And she's, we get to the beach, and it's Layla runs to the ocean. I'm like, oh God, I can barely swim, gotta go after that one. Scarlett's sitting there petting a horse, some wild horse on the beach. I'm like, oh my God, what's going on? Marley's asleep. It was wild. But so the guy's like, does she wanna ride? And I'm like, yeah, totally, she would love that. And she rode around on the beach for 10 minutes, and she talked about it all day long. It was so cute.
Good.
Yeah. She had a great time. Oh man.
She had her own hippotherapy.
She totally had some hippotherapy. And I know you're directing that, and I'm probably using that. We're using it loosely now, relative just to all horseback riding, right? But I know that there's an approach and there's a technique, and you're up in Baltimore County, right?
I'm in Howard County, yeah.
Sorry, you're in Howard County. Oh, you are? Okay. I feel like most of the farms around here are up in northern Baltimore County, so surprised it.
There's a couple people that do that, and it's awesome, and I'm glad that it's growing in interest because I think it's very beneficial. And so.
That's awesome. I appreciate you. Doing some trigger point therapy on the shoulder, on the rotator cuff, infraspinatus. I'm gonna get to the supraspinatus, the teres minor, and now I'm working on her upper trap because you'll find some of those reflexive trigger points in that area where she's straining her shoulder. There we go. How do people find you if they want to use your services?
I have a cute website and a little social media page.
Carly's gonna tag it on the top comment here.
All right.
Yeah, so if you've got an individual or somebody that you think could benefit, or if you just want more information on it, check it out below. Sure. So you've been getting dirty on 3 times. We're gonna use some stem. You come to the room, we'll do some soft tissue work, some adjustments. Last time you were in, we did some sinus releases. You got the light therapy.
Yeah.
Sometimes I'll also dry needle in conjunction with the super tight spot. With the laser therapy, I'm going to the spine of the scapula. And I'm working up with the belly of the supraspinatus muscle, palpating the turf, minor sensory point, and here, pressure point, whatever you want to call it, Ashi point. Ashi point is in acupuncture. I think it means, oh God, they told me it meant it hurts here. But that's like a name for like a meridian point as well. A lot of crossover between acupuncture points and trigger point dry needling. Probably a reason for that. You doing well with all these so far?
Yeah, they feel good.
They feel good? Awesome. You let me know if it's too much. I'm trying to give you space and me space. Let me do this. Stop matrixing myself. There we go. Just fanning the needle, just working the needle back and forth before I let her sit with these for 10 minutes. And it kind of looks wild, like to see a needle kind of sliding back and forth like that. And I'm on purpose doing that in the sense of creating some stress in the tissue. Lateral deltoid. But the needles don't cut, they push. They slide through the tissue. They're not beveled like you would get blood drawn.
Where's Eddie?
She can handle some dry needling though, there's no doubt about that. That's not like easy to like throw. She's making that look way easier than it is. I'd be like, oh!
But I'll take it.
So working on the rhomboids, working on the levator scap, lateral delt, all these different tissues around the shoulder, pressure there. And then I'm going to hook up some stem to her as well, to the needles I should say, which will stimulate that tissue. It'll drive that endorphin response in the tissue a little bit more. There's pain relievers that come in with dry needling. I kind of equate it, the scientists of the world might refute what I'm saying, but it's just an easy way of understanding it. It's like adding heat to a chemical reaction. It's a little bit more work to that tissue in a positive way. So relative to that, let's get working. Electrical stimulation is used a lot in physical therapy and in chiropractic care in different forms. and acupuncture as well. Acupuncturists tend to, and I use this in school, have like a little pen they'll hold up to it and stim one at a time. These are really, really awesome machines that we have here that do a great job of maintaining a good current. We're going to use a low frequency with her shoulder. It's not something that she injured yesterday. And so I'll set that frequency accordingly. So it'll feel like more of like, as well as that, like, on more of an acute setting, I'll increase the frequency like that. How did my stim noises sound to you, Kara? Was that spot on?
Yeah. Love a good sound effect.
Yeah, try. Alright, nice and easy. We're going to work the trap and super spinals first. You're going to feel a little thumping. We got some action there. Carly, check it out.
They're dancing.
Look. He broke the fourth wall. Oh no, that's when you talk to them. Oh, you can talk away. You're good. I love when you talk. So we're going to turn that up a little bit more. Let me know when it's strong but comfortable. It's already kind of right there where I would like it. Do you feel good with that level?
Yeah.
Okay. Strong but comfortable, like I said. I don't want to be sitting back playing patty cake with these. We need some work done, but we don't want it to be uncomfortable. So we're going to go to the teres minor and infraspinatus area. Mostly teres group. And you're going to start to feel a little stim.
Dang.
And I'm liking how that's moving right there too. You okay with that?
Yeah.
Do you feel that?
Yeah.
All right.
How could she not feel that?
You'd be surprised. Sometimes people don't. Even I'm like, okay, we need to turn this down. They're like, yeah, I don't even feel it yet. I'm like, your muscles are jumping off the table. So sometimes awareness in an area is different from person to person. That's a side story for another day. We're talking about hippotherapy here. We're talking about someone that's giving back to some people in a cool way, in a good way, and we're getting her ready for the big day.
Thank you.
Do some soft tissue work and adjustment next. You chill for 10 minutes, okay? Hey everybody, this is Dr. Ward here at Kalkstein Chiropractic in Towson, Baltimore, Maryland. I'm with Rachel today. This is our second appointment, Rachel. So I've never done a second appointment kind of video before, but it's a nice one because we get to catch up a little bit on your very first visit with me. And relatively speaking, get to catch up on how it went, how you're feeling. It's early on. Like I kind of equate a lot of body manual work to going to the gym. Or like getting into like a workout routine. You don't go to the gym and you're like, I lifted my biceps, I'm good for life, I'm good. Now sometimes when people are coming to see me with a problem, not always, but sometimes it's like a little bit of work in progress, if you will. And I kind of categorize it into different areas, if you will, when we work with people. We as a team do this. We focus on feeling better faster. That's the pain portion of care. That's what we call it. And so a lot of the times that's what brings people to see me. Rachel, your neck was bothering you.
Yes.
You're having headaches, upper back discomfort. You're like, oh man, I need to get back in my routine because she had good experience in the past with chiropractic.
It's about 3 years ago.
A while ago, right?
Yeah.
Yeah, it's, and like from your perspective, it's been 3 years since you had a good rhythm of things as it relates to that.
Yes.
Life, right? And then you're back and I love what she does for a living. She works with kids with special needs, and you're on the floor, you're playing, you're interacting with them a lot of times. It's a very physical job, I'd imagine.
It is.
And so that's been happening since you've gotten back here, right?
Yes.
And then what happened next? What kind of was just like, what was the domino effect to have you come here?
I think that just having the pain on and off and moving to a new city, I wanted to go back into a routine of getting healthy again, and so I wanted to come back. I know I kind of missed the relief it brought.
Yeah, I'm biased, but I love that Rachel's approach was like, I'm getting my team together, right? Like, I've got my rhythm back, and then I know what helps me, and I want to maintain good health. And my neck's starting to bark at me a little bit. I gotta find my chiro or my body guy in the area, body woman in the area, right? And so you've had good experience with chiropractic care in the past. That's one aspect of what we do here. And so you came in to see us, right?
Yes.
All right. So 2 days ago was your first appointment.
Yeah.
All right, candid. Let's hope it went well.
Yeah,
How
it
are you
did.
feeling?
Really good. I really it did help loosen me up a little bit.
Good.
I love the dry needling that you do as well.
Nice.
That always helps. It feels like it breaks up that tension, so I get that relief from that. I do have a little bit of pain from like right under here, under that shoulder blade. Kind of from last time, I think.
Yeah.
But other than that, I felt, pretty relaxed.
Everything was really good, but there's some
Yeah.
soreness that's like kind of like, oh, that's new. I need to work on that. Then
Yes.
thank you for telling me.
Yeah.
And I'll work that out for you. I promise.
Awesome.
Okay.
Yeah.
And so, do you mind if I share some of the initial complaints and just kind of your the diagnosis, if you will? Is that okay?
Yeah,
with you?
feel free.
Thank you. So relative to that, the first thing, we print out a report and we go over this with you on your second visit, and that's what we're doing now. So relative to that report, there's a couple components to it. This is kind of, we call this your recovery plan, or what we want to focus on, okay? So there's the functional component of what we have here, and then this is the actual area that's irritated. So your cervical joint restriction, or cervical segmental, that just means one of the segments, is restricted or irritated, okay? The functional component of it is like what creates that type of problem is oftentimes it's repetitive stress patterns, and to categorize that, it's upper cross syndrome. So where your upper traps and your pecs are tighter is a really simple way of looking at it functionally, and then where your deep neck flexors and your lower traps or mid back are not engaged as well. So you have this imbalance of over tight and weak, right? And so that creates like the visual cross if you look at it from the side of the body. So tight, tight, technically not as active, or we'll call it for lesser words, weak, and mid back weak. Okay, and so when we're kind of always working from here, if you will, or we're getting stressed in those areas, it can it can create neck pain from joint restriction, like what you have going on. That's why we're adjusting you.
Yeah, that sounds about right.
Yeah, it's like, that makes sense to me.
It does.
But it's important to understand that this is something that you can totally get control of and work towards improving, and I'm a catalyst for that improvement, okay? Ideally. So your treatment plan is twice a week for 4 weeks. I'll reevaluate you after a month of care, okay? Your goals for care are to decrease your overall pain, improve mobility, range of motion, and then get back to work without the discomfort and pain. We talked a little bit about physical exercise and getting into a healthy rhythm of walking and other exercises that you enjoy, but right now you're just looking for relief.
Yes.
Does that sound about right?
Yep, that sounds right.
You don't get severe headaches and migraines, but you do get them periodically.
Yeah.
You don't get them often, but you do get them like once a month is what you were saying now is the case. And we talked a lot about kind of the neurology of a headache and migraine and all the factors, literally systems, different parts of our body and life that goes into getting them, right? And so we always kind of look big picture, and I focus my energy in here with you on your neck and upper back, right? And then I give you ammo or information like, hey, this is how you can better equip yourself with handling them in the future, right? Managing stress, nutritional components, sleep, a lot of different levels, if you will, stimulus in the eyes, those kind of things, with screens, they all play a role in it. So that was another component of your diagnosis, or what we're going to work on. What has some room for improvement, as I like to spin it, if you will. Alrighty. So we went through those. There's a good different definition of migraine. We talked about the difference between migraine and tension headache, and this does a good job of just explaining that for you. It's important to realize those differences, because once you know what it is, you can understand better what causes it. And when you understand that, you can change.
Okay.
Right? And so we'll go over those more and more. Okay, what we're doing with you to help you out. You heard I'm talking a lot. I'm sorry, you're like, come on, that shoulder spot right now, you gonna work on that? You gonna be talking while you work on me? I got you.
No worries.
Well, I appreciate that. So we're doing some myofascial release, some adjustments. We're doing dry needling. We've got therapeutic exercises and stretches. She started those last time, actually. She did a good amount of work done last time she was here. And then we talked about, there's some information here on workstation, how to position yourself at work, like really simple things. And that comes down to like limiting the things that aggravate you. And all of this basically describes that to a lesser extent. Staying hydrated, pillow selection, and aerobic exercises, which can be really good. And then dietary triggers for migraines, looking at things like that that can lead to it. And like we might not think about it, but caffeine can be a trigger, right? And there's some other ones here that are really common for some of the components they have from a nutrient standpoint. Like I didn't know that garlic was one. And then finally, lifestyle and environmental triggers for migraines as well, which I love. I love Chiro for this. They do a great job of patient education. So on here is a rundown. I try to be as transparent as possible, and I think that's actually, you're supposed to be as transparent as possible, but not everyone does it, as it relates to the cost of care, right? Like, what does it cost, what's covered, all those things. And for your insurance, all your information is right here for you, and that's going to be what you owe per visit, okay? She just has a copay. I don't need to share any more than that. But that's just our copay. Everything that we're doing in the office that we are doing right now, it goes towards that copay. And then that's different than the deductible. Anyways, these are all the modalities and services that we offer in the office. If you're like, hey, what is Journeyland doing again, and what's the point of it? This does a nice job of explaining it. And if you have any questions about any of the things on here, like Shockwave, about nutrition, we have a strength program in the office, we have a massage therapist. There's a lot of different components. And we will soon have primary care and integrated medicine with regenerative medicine starting this summer. I haven't shared that, Carly. We should do these videos more often. That's happening. I'm so excited for Caroline to join us. So this is yours to take, okay?
Thank you.
Most importantly, do you have any questions about any of that?
No, I don't think so.
Okay.
Sounds good.
I'll focus on the areas where you have that pain, right, that we talked about. The upper cross stuff and the functional components of it, that's where the stretches, that's where the PT that we're going to be doing with you comes into play.
Okay.
And I really believe that if you follow this plan, I will have really good results with you. And ideally, the experience coming in here is great. You'll be met with by great people. Okay?
Sounds good.
Awesome. Let's go ahead and have you stand on up. And we will do some easy soft tissue work on the hands and neck. Shoulders, all of it, okay? So you can, if you're comfortable, take your glasses off. If you want them on, you can keep them on.
That's okay.
Awesome. And then rest right on the back.
Yep.
No, you can put your shoulder where you're like, it's a little sore in there.
Yeah.
There?
Right there, basically.
Oh.
Yeah.
Okay, you can rest your, and then you can rest your hands right underneath your sternum. There you go. All right, how did you find your way into the world of working where you work? What kind of got you involved with that?
So when I was younger, I always wanted to be a teacher.
Yeah.
And in high school, I volunteered in a preschool special education class and just really loved the population. So I decided I wanted to work with kids with special needs.
Nice.
And I went to college for special education, and I was a teacher in a special ed classroom for 6 years. And then I decided to go the private route and do ABA therapy.
Which ABA therapy, she was telling me a lot about that. So if you're someone that works in that world, what a nice way of like kind of changing things up and transitioning to a different service, and a very much needed service as it relates to helping, it sounds like, really address the root problems and provide support while doing a good functional assessment. Does that sound about right?
That is, yeah.
Cool. But this is your time. So let's not let my curiosity about your work, your profession, your past life get in the way of getting you some relief in here. Let's just focus on taking care of you, all right?
Sounds good.
So you rest. I'm going to talk out a little bit what I'm doing.
No.
Other than that, you're good, you chill. So doing some, just some traction with my hands on the base of her skull and that upper neck area. Where she was like, yeah, right there, like 2 days ago when I was working with her. And that was at the base of her neck, base of her skull on the right side of her neck, that upper cervical spine. Be tight, a lot of pressure can exist up there. So I'm going to do some myofascial release, some ART in that area. Turn your head to your left. There you go. Keep relaxing.
starts here on the suboccipitals, and I'm going to go down a little lower. Then I'm going to work on the upper trap into the shoulder blade. I'm going to work down because your neck is just letting go perfectly. You're moving really well. And then let your jaw relax. So a lot of times cervical spine associated with the jaw. I'm going to work on the right side of this jaw a little bit. Gently open. TMJs. A lot of times I have TMJ. People say to me, which is a fair statement, and a lot of times people clench.
I know I do at night. I do a lot of like grinding at night, so I wear a guard.
Yeah. We're less, able to inhibit that reflex at night when we're trying to rest, especially. We're practicing it throughout the day. You just don't realize it. Right? And so, a very common approach. And I'll speak to this. What's the goal, right? Is to eliminate clenching, right? The goal of the guard is to eliminate damage to the teeth, okay? It is going to do the opposite to clenching over time, relative to you holding something in your mouth through 10 hours of sleeping. So it's not a bad thing that you're wearing it, but more often than not, I find that it doesn't contribute to solving the original problem, right? Sometimes the original problem is kind of a hard thing to nail down, if you will. And that's okay. It's just just be mindful of the actions and the steps you're taking. So there's ways of kind of working on your jaw and your neck before you go to bed and not wearing that ideally, where you can really stop that reflex and then getting to the root problems even more. So sometimes it's purely just like a neck thing as it relates to why people are clenching. More often than not, there's layers to it, right? We're busy.
Yeah.
A lot of transition, especially early on in your 20s and 30s, school, and then work, right? And then all the good things that happen in between. So that plays a role in it for sure. Gently open and all the way forward. We're going to stay focused on the neck. We can dive in. I can talk to you some. We can do a TMJ video, Carly. I'd be happy to do that. I really like showing people how to stretch this out, how to move it side to side, how to work on the joint itself, how to do some self-massage work in this general area, even internally on the pterygoid. It's a really easy way of doing it. And then how to create stretches that do this. It'll feel like this for you. I'll show you. So it goes here and here, and then you pull. You feel that pressure you get right there?
Yeah.
It's lovely.
It feels really good.
And then you can do the same thing here. You push and pull on the occiput. And I'm just going to glide back and forth. I'll work around your earring a little bit, no worries. But push, pull, stretch. Nice. Good. And that will really help with a lot of this pressure that sits right there on you. Okay? I'll show you how to do that next session a little bit more in detail, okay?
Sounds good.
Let's focus on your neck. So gentle release here, loose, easy here. Good, let your head fall. Beautiful. Alexa, play Al Green Radio on Spotify. I like Green 5, but they're just a little bit of a play on radio, you know what I'm saying? Rest. Nice. There we go. Okay. I'm going to bring the table up, okay?
Okay.
How was all that?
Good. Yeah. Definitely felt good laying on my neck and relieving like
Awesome.
Yeah.
Nice. We'll do this. We'll go 180 style. So just stand up for me when you're ready, and then I'm going to open this up. You're going to turn around. There you go. Lean on in and relax a little bit, okay? So after I work on her upper back a little bit here, okay? I believe. Oh, you followed that. That's so kind of you. Dr. Angie will probably do some dry needling here. You can meet Dr. Angie, our preceptor, student chiropractor Kendra, who's on the team, who was originally an assistant here. I don't know if you'll remember her. All right, let's work that out, yeah?
Yeah, sounds good.
Breathe only. Easy exhale, let it go. Good job. And we'll get releases just on pressure like that. Yeah, we're doing a great job letting go. Awesome. Alright, easy. Release tension just in your mid back here. Good. And just a tiny release up top. There it is. Good. Awesome. Take your left arm and drop it for me. Nice. Take your elbow to the ceiling, just like this. And then drop it. Work out the rump blade trigger point she's got back there that she was telling me about. Cool. Let it drop. Alexa. Alexa. Volume up 1. Level up. Good, and drop it, let it fall.
I didn't even know you could reach that.
It's like,
It feels so good.
I feel ya. It's like I didn't know
I'm
that
like,
could even get worked on.
Yep.
Drop down. Said the truth. Oh, good, I'm here for it. Good, back up. So I'm shortening the muscle, pinning the muscle, dropping the muscle. I'm taking pressure and sliding, and this feels really nice when I get to that on her. And then I just hang out until she gives up a little bit, and that shoulder, like, let it go. There, nice job, you feel the difference?
Yeah.
And then you just start to let go, and I just lean into it. 60 to 90 seconds of compression, especially when I can incorporate active range of motion. So your techniques from Stecco. You got it? No, just last one. This is enough work on this area. It'll feel better. Easy. Okay. Alright, little TLC on the right side so it's not jealous. It's not a little bounce.
Sounds good.
Awesome. Okay. So, in the beginning, this is our manual therapy. I'm focusing on her primary complaints going in. We'll get to some secondary complaints along the road. And I'll listen. She says jump. I'm like, how high? No, I'm just kidding. No, for real. We're gonna help you out. Looking forward to it.
Thanks.
You're welcome. Yeah. We'll do some dry needling. You'll see that if you're okay with it.
Yeah.
And I'll ask her again when the camera's off, so it's not like you okay with it. It'll be awkward. And then we'll maybe do some brief video shoots of some stretches and exercises that we do here. But I hope you got something out of that. I hope you, if you have any questions, you can throw them below, and I'll get back to you guys. And thank you, Carly, for